The risks include the standard risks of surgery, which would include risk of bleeding, infection, spinal fluid leak, which are risks of any operation on the spine. The other risks include the risks of a general anesthetic. Of course, the surgery would entail a general anesthetic for approximately 3 hours. The other risk would include, and the risk of general anesthetic would include risk of potentially of stroke and heart attack that could even lead to death in very rare instances. The other risks include the risk of not being able to improve. The reason to do the surgery is to significantly improve back and leg pain, and there's certainly no guarantee with either treatment that you will receive the kind of outcome that we all hope that patients would. The specific to fusion, the risks of fusion include failure of fusion or wearing out another level, each of which would require potentially a second operation. With the TOPS device, since it is a moving part and moving things can wear out, and if it were to wear out, it may require a fusion type of procedure.
From a specific standpoint as to the risks of a fusion versus the TOPS device, the risk for a fusion is going to be infection. There's a risk of nerve damage by doing the decompression or putting the pedicle screws in. There's going to be risk of the pedicle screws breaking or loosening in the future. There's a risk that the rods will break, and those are haven't happened in many years. They're just the structure we use now is just not going to fracture. There's the risk of the fusion not taking place. Literature shows about a 80 to 90% fusion rate. But with TLIFs, it's almost 100%. Dural tears where there's leakage of cerebral spinal fluid is certainly a risk, but that's usually sewed up right away and not really a potential long-term issue. And then there's the risk of how much better are you going to be? Is your nerves going to respond to the decompression and actually have good relief of your pain? And typically they will. The TOPS device has similar risks for hardware failing or the screws failing, the instrumentation failing. Same risks for insertion of the device. We're not waiting for a fusion to take place, and then the risk you have is, well, will other levels wear out in the future? So they're very similar risks in both situations. The only difference primarily is you're not waiting for a fusion to occur.